Ladies and gentlemen, we're coming up to 5 o'clock. Before the meeting starts, may I please remind everybody that this is being recorded and will be made available publicly. Can I ask people to put their comments and questions into the chat box, and also when we come to questions, you'll be invited to ask your question via the chair. At the end of the meeting, we'll be taking questions and microphones will be enabled at that point. It's now 5 o'clock, so if I may I hand over to the chairman? Thank you.
Thank you very much. And let me start by wishing you a warm welcome to this annual members meeting for the year 2021. Earlier this year, I gave my maiden speech in the House of Lords, and one of the things I said about the people I've been working with in this trust and in the London North West Trust, what I said about both of those trusts and the people who worked in them was that I stood in awe of the way they performed during what had been one of the toughest times in any of their medical careers. And I still feel that way. I think there was a great display of courage and dedication, and that continues to this day. And it's the most important thing I can find to mention to you, that I really admire that. Then as I turn to the community that the trust serves, both communities served by Mount Vernon and by Hillingdon hospitals, we're very grateful to you for the close relationship we have, for the support we've received, for the appreciation of what all our people have done. That appreciation, in my view, is entirely justified. But nonetheless, thank you for it, and we appreciate it very much indeed. Finally, I'd just like to turn to the governors and to the board of directors and say thank you for your constant engagement in what's happening here, and constant efforts to drive up quality of care and to support our people as they went through this very tough year. So with all that, let me say welcome once again to all of you to this annual members meeting. And let me start by calling on Tony Ellis, who's the lead governor, to give his report from the Council of Governors. Tony, may I call on you?
Thank you. Can I check you can all hear me? There aren't any no's, so I'll go ahead. We've got 24 governors, 13 public, with 4 for each area in Hillingdon, and 1 governor from outside Hillingdon representing the surrounding areas. We have 6 staff governors. All these governors are elected every 3 years. We also have 5 appointed governors who represent Health Watch, the Council, London Ambulance Service, the CCG and the Staff Union. And I'm the lead governor, and the lead governor is elected annually by the other governors. What do? Public governors act as the link between residents and the hospital. We have no role in the management of the hospital. However, we can be critical friends. I want to make it quite clear that we do not answer individual patients' problems unless there is a general principle that needs investigation. However, we do point patients in the right direction. Staff governors communicate with the employees in the area in which they work. The governor's role and powers are set out in the Health and Social Care Acts of 2006 and 2012, and in summary, the duties are as follows: to hold NEDs to account for the performance of the board, to appoint NEDs, including the chairman, and agree their remuneration, approve the appointment of the chief executive as recommended by the board, appoint the trust auditors, approve necessary changes to the constitution, receive the annual accounts. I say receive, we don't actually approve them, and we approve any significant transactions. The most important of these, in my mind, is the work done by NEDs, and we observe them in action. NEDs, I mean non-executive directors. Observing them in action through attending board and committee meetings, having presentations by them, and personal contact. And so that way we ensure that they're fulfilling their duties. This year, we've held 4 public Council of Government meetings and have also met for training purposes. We also interviewed and appointed replacements for 2 retiring non-executive directors. This year has not been an easy one, as we have been unable to meet physically until very recently. However, public governors have made every effort to keep in contact with residents, colleagues and the hospital through electronic means such as Teams, residents associations, social media and personal contact. Many of you know how to contact your local governor, but if you need further details, please contact the Foundation Trust Office as shown on the slide. Finally, I'd like to express my appreciation and admiration to all the staff who have given their all during the COVID pandemic. They're exceptional people and we're lucky to have them in our hospital. Thank you.
Thank you very much, Tony. And let me now bring us on to the annual report to be delivered by the Chief Executive, Patricia Wright.
Thank you very much. I want to start by adding to both Tony and Amy's comments about thanks to staff. The word unprecedented gets used a lot in the NHS at the moment, but I think it is absolutely clear that 2021 was an unprecedented year for the NHS, and staff faced both wave 1 and wave 2 of the pandemic and really have stepped up to the mark and have continued to provide really very high quality care despite the impact it's had on both their personal and their work lives. This was a very challenging year for the Trust. Not only was there a significant change in leadership, we felt the impact of the pandemic, and overall there was a huge change in the way we needed to deliver care, and you will see that in our annual report. But despite that, I think you will see in our annual report, and what I'm going to highlight, that staff demonstrated very high levels of innovation and achievement alongside delivering the day-to-day. I want to be really clear that we, as part of the pandemic, continue to provide business as usual wherever we could, and that we are closely monitoring waiting lists and the quality of care through our integrated performance report, and that we absolutely strive to maintain safe care and business as usual functions as far as was reasonably practical during the year. And you'll hear a bit more of that when we hear about the quality account. Can I have the next slide, please? So just to give you a sense of the Trust, we had about 50,000 attendances in our emergency department last year. And that was a reduction, you'll see in a minute, that was a reduction in our normal activity. That doesn't sound like a very high level of activity, but actually that is what we see in our A&E, the term that most people know, but we also have an urgent treatment centre that runs alongside our A&E, and we see high numbers of patients through the urgent treatment centre as well, and that's predominantly people who have minor injuries or minor illness who can be seen by a GP service. In 2021, we still saw 240,000 patients in outpatients, although in practice, a number of those outpatient appointments were done remotely or by this kind of video conferencing, so a very different way of providing our care. We complied largely with our 32 and 64-day NHS cancer screening targets. And we worked very hard, although we didn't achieve our complaints target throughout the year. We did log all complaints within 3 days, and we really strove, even when we weren't required to continue to try and turn around complaints responses as quickly as possible. And actually, by the end of the financial year, we were hitting 100% of complaints being delivered within our 30-day target. And one thing that we're very proud of as an organisation is that we had zero domestic waste going to landfill, and in fact as an organisation we've concentrated very heavily on how we become a sustainable organisation, and actually have been able to bring in quite a bit of additional resource to help us with our green agenda. So it's something we're very proud of. What you can also see from the chart on this slide is that despite us having a year of COVID, we did slightly improve our performance, our urgent and emergency care performance. And in fact, our cancer 2-week wait performance also slightly improved, although in all cases our performance was below the target that was required nationally. Can I have the next slide, please? I think it's really important to understand that actually during COVID, we did continue to provide quite high levels of activity. So what you can see here is that the activity through our emergency department dropped by about 30%. Our admissions for emergency treatment dropped by about 20%, and our admissions, particularly for elective surgery and day surgery, dropped by nearly 50%. Now, we were absolutely in line with other organisations across the NHS. We were asked specifically to stand down our elective care and very much concentrate on patients who needed care if they were COVID positive. But I think it's important to understand that despite the impact of COVID on the way we provide care, actually overall our total contacts only decreased by about 30%. And it says a great deal about our staff and the way we've adapted our care, that we were able to continue with quite considerable amounts of care throughout the year. Next slide, please. I think it's really important at times like this to first of all recognise that our performance wasn't where we wanted it to be, but also to celebrate achievements. Organisations like Hillingdon very often are scrutinised quite considerably from external regulators, and actually what happens is that all you hear as members of the public or members of staff is the things we're not getting quite right. And in fact, one of the things that I've been really struck with as I've joined the organisation, and I joined the organisation in December of 2020, is how much good work is going on in this organisation. There are pockets of absolutely exemplary care that staff should be really proud of. And even in those services where we're not performing to the level that we would wish to, staff are working very hard to try and bring services back on track. So just to give you some examples of things that we did achieve during the year, we joined the Care Information Exchange Service, which enables patients in North West London to sign up to access information about their care. And actually, if it's something that you haven't signed up to, I would highly recommend it. It does mean that when you see your GP, you can have easy access to your test results. And that's something that's been done across the whole of North West London, but as an organisation, we've been very actively promoting. We rolled out digital appointments, both telephone and video, to reduce the risk of spread of infections in our hospitals, and actually are one of the leading organisations in North West London in adopting this technology. And we've absolutely progressed with plans for a new hospital on the Hillingdon hospital site, and you'll hear a bit more about that later on in the presentation. And things that we've won awards for, and these are only a tiny example of things that we've won awards for, but we won a Food for Life Bronze Award by the Soil Association about our facilities and catering team. We won a bed maintenance and biomedical equipment maintenance team award because they were accredited during the year for quality management. And as I said before, we've concentrated very highly on our sustainability programme and have won the Green Apple Award for environmental best practice. Can I have the next slide, please? So you will hear more in the presentations that are following about some of the action we took around COVID and what we've done to improve quality. What I want to do in terms of looking ahead is really just to stress the fact that we absolutely need to learn and are learning every day from what happened during the pandemic, how it affected our everyday work, how it affected the way we communicate with patients and the public, and what we need to do in terms of going forward. But actually for us, it was a very unusual year. And what we must now do, and already have started to do, is to make sure that we're looking ahead and thinking about how we could get services back to normal and transform the way we work learning from the COVID pandemic. So really there are three things I want to stress. First of all, looking forward, we will continue to make progress on our transformation programme and how we work collaboratively with partners, both at a place level in Hillingdon, and that's our multidisciplinary partnership with the voluntary sector, the local authority, our local community and mental health provider, in terms of looking at our local population, but just as importantly, working very closely with our acute provider colleagues across North West London in terms of how we provide care and make sure that there is equitable care for patients across the sector. So transformation is an incredibly important part of our agenda for 21-22. We continue and have started this year on a very focused journey to recognise and create a culture which respects and values individual differences and encourages everyone to develop and maximise their true potential. And that's not just thinking about diversity within our staff population, which of course is very important, and it's very important that staff, whoever you are, wherever you come from, that you've got equal access to training opportunities, career development and promotion, and that we recognise and do not discriminate if you have a disability or you have any other protected characteristics. Now, this is something that we haven't had a lot of resource to focus on over the last year, but we've just recently appointed an equality and diversity lead, and I'm really pleased to say that that's a piece of work that we're really starting to move on. However, that's not the only issue around diversity. We serve a very diverse population, and it's incredibly important for us that we recognise in the work we're doing around our emergency performance and actually starting to ramp up, or having started to ramp up, our elective programme and making sure that we take action on backlogs and waiting lists, that we're absolutely sensitive to making sure that nobody is discriminated against and that we are actually treating people in a very fair and equitable way. And then the final thing that is very much part of our here and now and part of the future is making sure that we progress and continue to progress with the Hillingdon Hospital redevelopment. It's well known in our local community that we absolutely need a new hospital, a new acute hospital for our local population. And as I say, you will hear a bit more about it in the presentation. But we absolutely need to make sure that we improve our performance, that we are absolutely on top of our finances, and that we progress that agenda as quickly as possible. So thank you, and I'm going to pass on to our Finance Director, who will take you through the finance report.
Good afternoon, everybody. I'm John Bell, the Chief Finance Officer. So it gives me great pleasure to present the financial numbers for the year that ended in March 2021. So as you heard from Patricia, it's been an unprecedented year, and I think that's certainly the case when you look at our financial numbers as well. So we saw a significant increase in the level of income that came into the trust in 2021 as part of the national funding that was put in to address the COVID response and to support organisations through COVID. Our income actually went up by around £41.5 million between the 1920 and 2021. We saw some increase in costs, as you'd expect as well. Some of that was in terms of addressing the COVID response, and overall our costs went up by about 20 million. In fact, so as a consequence of those changes, actually we still ended the year with a deficit of about 5.2 million. However, that compares to 26.2 million the year before. And actually within that 5.2 million, there were 5.7 million of impairments, which is effectively where the value of the assets that we were carrying in the balance sheet was different to the valuation that came through, and therefore we have to take that reduction into our position. So if you exclude that, we actually saw a small surplus coming out of 2021. We had a lot of cash in the bank as well. You'll see on the slide here, we had 9.8 million the year before at the end of the year, but this year we had 47.4. And that relates to a significant capital program, which I'll speak a little bit about later on, where we drew down the cash for that program before the end of the year, and that resulted in us holding some very large cash balances. And you can see on the next line, we had a very substantial capital program for an organisation with a £300 million turnover. In this year, we actually had a £67 million capital program, and again, I'll speak a little bit about that on the next slide. Next slide, please. So just in terms of how we spend our revenue, so we spent about just over 300 million in the year that's just gone. and there'll be no surprise that most of that goes on salaries. We spent about 69% of that spend. 204 million was on our staff. Next comes clinical supplies and services, and then followed by drugs. And then the other sort of point in highlighting here, we spend about 4% of our income, as do a lot of NHS organisations, most NHS organisations, on our clinical negligence premiums, and that's what is reflected there in the 11.1 billion. But overall, as you can see, we are predominantly a staff-run organisation, and hence nearly 70% of our expenses go on staff costs. Can I have the next slide, please? So just in terms of the main features this year from a finance perspective, so the whole of the NHS moved into a block funding regime, so and we received top-ups to ensure that we balanced our position and broke even overall during the year. But the whole of payment by results was suspended, and that is currently the case as well. So in the year we're in now, in terms of in 2021-22, we are currently working under a block funding arrangement, and will do for the rest of this year. As you heard from Patricia, our activity, and in particular our elective activity, dropped quite substantially during the first wave, as we had to focus on responding to that. And part of the reason why all trusts were moved to block was because under PBR we would have lost significant amounts of income as a consequence. So it was really to protect organisations as we responded to the pandemic. We saw significant capital investments, and I'll talk a little bit about that in a second. But we also saw increased staff absence during the pandemic, both because staff had to isolate if they came into contact with COVID patients, but also as a consequence of sickness, both due to responding to both COVID sickness, but also the impact of actually what was a very stressful situation for the organisation. So you can just go on to the next slide, please. So in terms of responding to COVID, we received funding for COVID during the year as well, and about sort of half of this spend was on responding to the pay costs. So this was additional staff, both in supporting those that needed to go off on sick or isolating, and also additional staff needed in particular areas that were under huge pressure during the COVID period. The rest was spent, a large element of what we spent was on PPE as well. So you'll see there's 3.4 million spent on clinical supplies and PPE, although we also received quite a substantial element of PPE which we didn't have to pay for, which was supplied by the Department of Health. But overall, our response to COVID in the year, we spent about just under £12 million on responding to the COVID pandemic. You can go to the next slide, please. So I mentioned that we had a very substantial capital program. From the first slide you've seen, we spent about 25 million in 1920, and that rose substantially to 67 million in the year that's just finished. And that was for an organisation of our size, was a very challenging capital program to manage, and credit to the team that managed to bring this in and spend all the money that we were given we didn't actually get notified of the expenditure until quite late during the year. So the vast majority of that capital went on the decanting enabling works as part of the new hospital site, which you'll hear more about later on. But we also received quite substantial funding for backlog maintenance, particularly around fire and addressing some of our water safety issues. So there was a lot of money, additional cash that we were given for that. We also put more money into upgrading our IT systems, and then there's money as the spend as part of the new development in terms of the business case for the new development. We invested in medical equipment. We did an upgrade to the emergency department, and I mentioned before, we've actually done a lot of work around improving fire safety across the organisation. And a lot of these programs of work are still ongoing, and we're spending further capital on these during the year we're currently in. Can I have the next slide, please? So just in terms of looking ahead into the year we're currently in, we're actually just almost halfway through this year. So one of our big challenges clearly is our financial position. So although we've received a lot of funding in 2021, we still remain with a challenging financial position. We have had an underlying deficit for a number of years, which was reflected in the outturn for 2019-20, where we had reported a deficit of just over 26 million. So we know that we still have a challenging position, and we have a lot of work to do to recover that, particularly as we come out of the current block funding arrangements. That's going to be the big challenge. And we're working with the Recovery Support Programme nationally as part of a process of support to help us address our financial position. We have to recover our elective activity and get that back up to the levels we saw in 1920, which across the NHS is a large challenge. We're currently planning for the second half of this year in terms of the financial plans. Unusually in the NHS this year, planning was done in two halves. So we had a plan, we were issued with guidance and plans for the first half of the year, and now we've been issued with plans and guidance for the second half of the year. So we're we're doing our plans for the second half of the year. Currently, we have our emergency department in particular has been under considerable pressure, and in terms of a big part of what we need to do in terms of supporting that department and making sure it's adequately resourced to deliver, to address the pressure, but also working in the system and with our partners to try and reduce the demand on the department in itself. Our capital program continues to be a large one, and we continue to work towards our new build, and managing that capital program it continues to be a big challenge for the organisation. And the final point on here is, as an organisation that pays taxpayers' money to suppliers, we are under an obligation to try and pay those invoices, or rather 95% of those invoices within 30 days. We haven't performed particularly well with this, so we're currently working on implementing a number of improvements which will help us pay those suppliers much quicker than we have done historically, and we'll see a big improvement in that over the rest of this year. And thank you, that was all I was going to say.
Amos, I think you're still on mute, actually, if you don't mind just unmuting yourself.
Thank you very much, John. Let me just move on to invite Melanie Van Limburg, the Director of Nursing, to talk about the quality account. Melanie.
Thank you very much, Chairman, and thank you for the opportunity to talk to everyone today about the quality account. So, yes, I'm the Director of Nursing, and I'm absolutely delighted to be able to talk about the account. The quality account is a mandatory requirement for every NHS trust, but actually it's an opportunity for every organisation, us at the Hillingdon hospitals, to be able to show all of our stakeholders where we're going forward in terms of quality, and be able to outline what we've done, but also what we plan to do. So I'd just like to take you back a little bit to the last year, and all of this information is available in the quality account, which is available on the Trust website. And just like to highlight the quality priorities that the organisation set for 2020-2021. And all of these priorities that are set with our patients, with our staff, all of our stakeholders, because it's important that we set quality priorities that are going to make a difference to those that seek our services, so that we're able to measure how we're able to deliver those services. So several stakeholders would have been involved in setting the quality priorities for 2020-21, and I'll also tell you about the priorities that we've set ourselves. So this is a part of the quality account, and a key part of the quality account. So we set out in 2020-2021 to look at improving our discharge process. So this is everything to support patients in terms of going home safely, being able to be aware of information that's needed to ensure that discharge is known to next of kin as appropriate, and all planning put in place for every patient as an individual to reach their home or their onward destination safely. We also set up to look at improving the quality of patient information and signage around the premises. When you work in an organisation, you know where you're going, you know where a lot of the departments are, but actually as a patient or a stakeholder coming in, signage and information is really key to good care. We also set out to improve our complaints performance within the year, not just answering complaints, but also being able to provide good quality information for a patient or a stakeholder who would complain, and also for us to learn from complaints that come into the organisation. And we also set out to improve the way that we engaged with patients and carers of those with learning disabilities, key health needs that we need to take very seriously and provide good care for. May I have the next slide, please? Thank you. So I'd just like to highlight a few of the key successes that came from the quality account and the quality priorities over that period of time. So just touching on discharge process for our patients, we managed, as among several things, to be able to reduce the number of patients that stay 21 days and over in the organisation. Now that's so important in terms of patients being able to go home, because actually 21 days in an organisation, the longer you stay, the longer patients are away from home, but also they can be subject to infection, lots of other effects that we want to make sure patients stay safe from. So it's a good thing that we're able to reduce the amount of time that patients stay with us if they don't need to be here. We also looked at working with our Hillingdon Healthcare Partnership, so it's HHCP, and started to really dig down and to improve into the management of very complex discharges. Some patients and the needs that they have to be able to reach home or their onward destination safely takes a lot of planning, and sometimes from many multi-agencies to be able to effect a safe and effective discharge. So we made improvements in working with our outside stakeholders. We took forward through quite a difficult time of COVID, and we've heard a few messages around COVID and how different that was for healthcare to adapt. But actually, during that time, we improved the quality of our patient information and signage. Our facilities manager was dedicated to reviewing and managing signage requests, commissioning appropriate signage so people can find their way around, that's standardised and recognisable and meets the needs of all users. So if you come into the organisation and walk around, the signage is now pointing you in the right direction, and also that we have floor lining signage which actually takes you along a path of where you need to go. So when patients come in or visitors come into reception, we're able to say follow the yellow line, follow the blue line, and that will take you to where you need to be. There's still some work to do, and we're still keen in taking that priority forward, and we're still doing further objectives with that. We also, in looking at our complaints performance, we reached 100% of complaints being actually taken on or logged onto our system within 3 working days, so that we were able to respond to them, and all outstanding complaints were finalised during March in time. Now, that might be a target, but what's important to us is that we're able to have a timely reply to a patient, to a complaint that is helpful, that makes sense, but it goes in time so that it's within a reasonable time period. Because a complaint that comes in, we take very seriously, and we also use our complaints to learn from so that we can actually plan care for the future and constantly improve on what we do. The other theme that we were looking at, as I mentioned, was improving the way that the trust engages all of our nurses, our doctors, our multidisciplinary team engage with patients and carers of those with learning difficulties. And I think the important issue, learning disabilities, the important issue there was that we did a whole range of initiatives to be able to support patients and carers of those with learning disabilities. LD nurse stands for Learning Disabilities Nurse. So we have a learning disabilities nurse who attends the wards, plans care, provides support to staff in planning care for patients and working with carers to ensure that care that's delivered is as it needs to be for all groups of our patients. And we improved virtual communication with carers due to COVID-19. So a really difficult time with communication that's not always straightforward in terms of visiting. And we looked at different ways that we could provide visiting, but also provide communication through laptops, through phones and other means. I think also the important part about this particular objective is the fact that this covered so many of our patient groups. I was talking to our safeguarding senior lead nurse today, and she was recounting that this objective improved the care for paediatric patients, children, all the way through maternity patients and patients with all different very, very complex needs. So it was a work stream that we were extremely proud of in being able to deliver to our patients. Can I have a look at the next slide, please? So I'd like to highlight to you the quality priorities now that we're moving forward in the year that we're in. So we've built on some of our achievements that we had in the previous year, and we retained a couple of the priorities because we wanted to concentrate a bit further on that. So you'll see for our targets, so for number 1, our priority, improving patient discharge experience, hugely important. There is actually the more that discharge is relevant for patients, the more complex you realise that it is. So we have several streams of work working to improve experience of patient discharge. And what is particularly important is gaining learning so that we can take back improvements that we can go for the ongoing period of time to further improve patient discharge. And it's something we're hugely committed to. We've also pledged to work in partnership with our patients and carers to deliver high quality patient experience. So we were talking about complaints and responding to complaints and learning from complaints. We wanted to retain that particular element, but to widen it out and to look at patient experience in a larger theme across more groups of patients and carers. And now we have a very, and built on the very active patient engagement experience group, and we consult on a regular basis with our patient groups. And we're taking forward various work streams, consulting first with our patients. We also have taken a slightly new priority this year, and this is the improvement to prevention and management of VTE, so venous thromboembolism or blood clots. And the relevance of this is that as patients come into hospital, become less mobile, require treatment, it's really important that we actually look at, well, they are less mobile, the fact that we actually need to think about them not getting a blood clot in a limb. And we have several strategies that we take in terms of being able to do that. It's nothing new, lots of organisations do it, but actually for us it's really important because it's an element of safety as well as quality. So we have a whole range of strategies in terms of assessing all of our patients for blood clots, being able to provide the right treatment, to be able to document correctly, and to evaluate the treatment and the care that we give. What's been particularly also important for this is to bring all our multidisciplinary stakeholders together, because it takes a whole team to be able to provide this care. And concentrating on this priority has helped us bring this out as a key issue for us within the organisation that we want to further improve on. And our final priority, and again a safety priority, extremely important for our patients whose clinical condition may be deteriorating. We wanted to look at how we could provide an overall structure for that. So this is everything from training our staff in the organisation, being able to respond to emergencies, being able to determine when patients aren't well so that we can provide preventative treatment, and being able to audit all of the outcomes for all of our patients who are unwell. May I have the next slide, please? Thank you. I'd also like to just talk through with you some of the work that's been ongoing within the organisation that's been absolutely key, and we've made some huge strides forward in terms of quality. Many of you will know that the Care Quality Commission, the CQC, undertook a focused unannounced inspection at the hospital on the Hillingdon site during August 2020. And actually that visit then followed with a joint inspection with the health and safety executives as well, only a month later. So just to recap on those particular inspections into the organisation, because as I say, they were unannounced. Those visits looked at the safe and well domains in medical care and urgent emergency care. The CQC looks at areas of care throughout the board, and safe and well led are two of what they call domains. Looking at medical care and emergency care, there was a particular attention to infection control. So you might see through the presentation IPC. And as a result of that, of some of the gaps that we had at the time, the Trust had a notice of decision order. It's called a Section 31 and Section 29A of the Health and Social Care Act. Now, that meant that the organisation was required to give assurances of an effective system to assess, monitor, identify, mitigate and put in place plans for any risks identified in the inspection, and to provide change. And to move forward with safety. And that's what the Trust did. There was a very firm, robust project management response to this, and it was handled very clearly in terms of acting on the concerns raised by the CQC. And you can see on the slide it said that we introduced a comprehensive action plan, and that action plan was addressed at very regular intervals, and we saw improvement through the period of time, and the notices were addressed. I can give an update on that, is that at the current time we're waiting for the CQC to come back because we've completed the work that was required. We've made a submission to the CQC, and we're waiting to hear the outcome to that. And it was a lot of work to do, but we have made huge change from the approach that CQC made to us, and it's change for the future and onward change that we want to continue. I'd also like to highlight a really positive aspect that really goes alongside all of this work, that we have now a very established ward and department accreditation programme. Now, this is quite interesting because it's aligned to how the CQC undertakes their inspection and what they call their key lines of inquiry. So their inspections and the themes that they want to look at. And I mentioned domains before, so it's also based on the 5 domains of quality, so very closely aligned to an inspection document. And we treat these seriously. We have our own unannounced inspections, our own peer reviews, and we also do and invite external reviewers to undertake the programme. And I'm really pleased to say that we're on track with the Ward and Department Accreditation programme, and that this accreditation or this peer review inspection takes place in every clinical department that a patient will have care. So it isn't just wards, it is every single department ward in the trust. So overall, the trust is continuing to meet the CQC standards and requirements and overseeing all of the quality work streams that feed into our programmes. We've introduced quality initiatives. One of the more recent quality initiatives in the last 9 months has been quality rounds, team quality rounds as well. And those are different areas of care, and we audit. We work all out into the organisation as clinical teams. Overall, that also feeds into a programme called the Hillingdon Care Quality Programme. So every part of quality and safety that we monitor feeds into one place. Can I have the next slide, please? Thank you. I'd like to just give you a short update on COVID. So this is aside some of the, on top of the information in the quality report. And just to give you an update on some of the things we did during the pandemic. It was a very different time, and we were requiring to respond to lots of different challenges all at the same time. But one thing that we are still doing today is still complying with all of the guidance that comes through on COVID, both nationally and locally, and we link in with all of our infection control groups within the sector, and in order to ensure that our response is of high quality and is safe. I'd like to echo the information and that my colleagues have said in terms of our teams. It's been incredible in terms of the adaptability, the changing environment, the changing agendas, and the creativity and resilience that our staff have brought. They are to be commended, and we've looked at lots of different ways of finding our way round, providing treatment and care for our patients, and virtual consultations is one. And we've integrated fully within all other initiatives to be able to do that. Through COVID, we've also invested a great deal of time, energy, resource into improving IPC practices, and that continues to be a priority for us. We've talked about personal protective equipment. All of our staff have access to that and are tested in using the right equipment, which is absolutely key for their safety and that of our patients. We have instituted dedicated entrances for our staff to come in and our patients to come in and also to go, so that we're keeping social distancing as part of a basic of what we do every day. We provide lateral flow device testing for all of our staff and any information and advice they need around lateral flow. And again, that process to ensure that we keep not just our patients safe, but also our staff. And our enhanced levels of cleaning in clinical areas have been exponential. We have a very responsive team in terms of all the housekeeping that's provided to us, and they've constantly continued to adapt to all the challenges that have been put in front of them. We've had a campaign called Be Smart, Stay Apart, which came through in June, and that's stayed with us ever since in terms of social distancing. And it's something all of our staff understand and that we monitor very regularly. And we have different pathways for our COVID-19 patients that require care and our non-COVID patients that we need also to provide care and keep both streams of patients absolutely safe. We've also introduced room capacities. So every room that you'll walk past in the organisation, you'll see this room will take 2 people or 3 people or 4 people. And we're also very, very keen on monitoring that if a room is used, that our staff and indeed our patients are safe. And you'll see if you come into the organisation, we also have signage, one-way systems, posters, floor signage, and I've mentioned some of that when I talked about the quality priorities. So I hope that gives a sort of theme, a bit of a run through in terms of some of the aspects that we've been undertaking, but indeed they've been part of our quality account. May I have the next slide, please? I just wanted to also say any of the information regarding the quality report, because there's much more information in the quality report that I could share with you in this short period of time I've got, but please do look at the quality report, the quality account, and there's a lot of information that's provided many of the things we have worked to in terms of quality and safety. And I'd like to thank you for your time and for the opportunity to be able to present this afternoon. Thank you.
Thanks, Melanie. Great stuff. We all appreciate hearing it. I'm quite certain of that. Let me come on to Zoe Lane, who's the head of Safeguarding Families, and ask you to speak to us about safeguarding, Zoe.
Good evening. Thank you very much. I'm Zoe Lane. I'm the head of Safeguarding Families here at the Hillingdon Hospital's Foundation Trust. I'm just here to talk to you a little bit about what we've done over the last year and 18 months in relation to safeguarding of our patients. So if I can just go on to the next slide. So just to try and give you a briefing around what is safeguarding to us here. It is the measures that we put in place to protect the health, well-being and rights of individuals, and it's also so that we can ensure that the children, young people and particularly our adults at risk are able to live free from abuse, harm and neglect. And in the terms of the 2021 year, we also created a vision and a strategy to achieve those things for our patients. And so our vision for the Trust is that the team of our Safeguarding Families can ensure that we achieve the best possible outcomes for our unborn babies, our children and our adults at risk by having effective processes in place, by having training and supervision of our staff. But it's also to ensure that we support those frontline professionals, particularly over the last 18 months, and ensure that we have a culture here at the Hillingdon Hospitals where safeguarding is at the forefront of our care. And there has been a time in which safeguarding has been an add-on in terms of clinical care, but that is not the case, and we want to ensure that that culture is at the forefront. Next slide. I feel like Chris Whitty for a moment. So the impact of the pandemic. So you've heard a lot from all the other members tonight in relation to the impact of the pandemic, but I would just like to talk to you at it from a safeguarding perspective. A lot of our patients have been more vulnerable alongside their families in terms of how the impact financially, in terms of community support, in terms of respite for carers of our patients, and also the impact of visiting during key points of the pandemic has really impacted on how we have to safeguard the patients that we have in front of us. So the other bit around the pandemic is that for quite a long time, we were the most face-to-face professionals that a lot of our patients saw. So they could have gone quite a number of weeks and in some cases months without seeing the usual professionals that they had around them to safeguard. So that's why we made every contact count during this time. And that's what we instilled in our frontline professionals. And also that as the Safeguarding Families team, we would support those professionals when they had recognised or identified any concerns, particularly as the clinical care and aspect was such a heightened impact of the pandemic. So some things I'm just going to give you some little bits that we try to improve, and that was around training. So obviously with the infection prevention control impact, a lot of our training had to move quite effectively and quickly to online training. So we did that, and it's also been replicated across the Northwest London area. We also developed around the making every contact count, and we found that a lot of our adolescents, particularly those who were no longer able to get to education and have professional face-to-face contact, we ensured that we had risk assessments in place for all of our frontline professionals to be able to ask questions, just even if, do you feel safe? How can we help? Any support that we can help with. And so we ensured that assessments were taking place in a quick fire way, and therefore we could get the support in when required. Next slide. In terms of what we also did, so from the 1st of October, we're coming up to a year now of having the Safeguarding Families team encompass quite a lot of other key areas that were required for our vulnerable patients. So in terms of that, we expanded it to safeguarding adults and children, but also including learning disabilities, mental health, our MCA, which is our mental capacity assessment, and those who have to be deprived of liberties for key points, just to make sure that they have the care that they can have to ensure the best outcomes from them. And we also have a paediatric liaison service, which very much communicates with the community and ensures that particularly our children and families get the support on discharge that is required by having good information sharing. So this was started on the 1st of October. We're coming up to a year, like I said, and what we kind of wanted to really get out of it, and the main goals were that our vision of the front line and our forefront of our care was safeguarding, inclusive, encouraging to communicate with the safeguarding team so that the frontline staff didn't feel like there was any type of obstacles or obstructions to communicating with us and other members of the team, to minimise any delays, because if our families were requiring some support and they needed that to be built into the community, we had to ensure that referrals went to the right agencies quickly and effectively to ensure that support on discharge, to enhance the cohesion across the safeguarding team, so we weren't replicating or duplicating the same processes or asking questions to our patients that had already shared a trauma and repeating that over and over again. We just wanted to ensure good cohesion. And also, and finally, our 16 and 17-year-olds across our trust, which is not dissimilar from many other trusts, is that they are located primarily within our adult services. And so ensuring that the training of those who look after our 16 and 17-year-olds in adult areas had the appropriate training, access to our services. And the main thing we were trying to get out was that before discharge, that we think safeguarding, that we ask questions that are pertinent and can get the appropriate support for our patients, and that we share information when it's necessary to do so. And next slide. And then just finally, in terms of the achievements that the safeguarding team had over this particular period of time, we did, like I said, online training. We shared it because the feedback was very positive from our staff, and we wanted to ensure that other hospitals were able to replicate similar training without having to go through all the obstacles of creating it in the first place. The adolescent tool, which I have explained, but also can ensure support around substance misuse, child and adolescent mental health services. And I know today, particularly, there's been a lot in the media around the difficulty in waiting times for our young people to access mental health support. So that was really a primary goal, to get that access and referral off as quickly as possible. And also that we were awarded the NHS Safeguarding Star Award from NHSEI. And we were also shortlisted into yesterday evening's Patient Safety HSJ Awards for the NHS Safeguarding Award. We weren't successful in winning, but just to get to the finals and to have it acknowledged the last year was very much appreciated by the entire team. So thank you very much.
Amy, you're on silent.
Yeah.
Just easy to get. So I seem to be involved in dabbing at my screen quite a few times to get it to start. Anyway, thank you very much, Zoe, for that, and great that you got to the finals, and it's obviously a very good team indeed. Let me go on now to hear from another very good team, and that's Jason Sees and Tahir Ahmed, Deputy CEO and Director of Estates and Facilities, about the redevelopment and estate of the hospital and the estates more generally. On you go, guys, please.
Thank you very much, Chairman. Can you hear me?
Yes.
Wow, there we go. So good evening, everybody. So this is the last piece on the agenda where we're just going to go through about all the excellent progress on the redevelopment. So if we just go to the next slide, what you've got there is where we're just highlighting the sort of key headlines. To recap, to get a new hospital is a sort of three-stage process. There's something called a strategic outline case, then an outline business case, and then a full business case. And so the key headline in the last financial year, so April 20 to March 21, was we got our strategic outline case approved. I think that is a huge testament to all our staff, because if you look at the context of the environment that we've been working in, it's been unprecedented over the last sort of 18 months. And within that, our staff did a fantastic achievement in developing a really coherent and excellent business case for a new hospital. The other key piece around that is our staff did that in partnership. So there is very much in all the redevelopment a spirit of togetherness. So as touched on earlier by colleagues, Hillingdon Health and Care Partners, a huge thank you. So Health Watch, our local GPs, CNWL, have all been working with us, plus the local authority, in very much everybody supporting the development of the new hospital. So that's all sort of worked through. Again, as you probably see in the news, there's something called integrated care systems. So from our perspective, North West London Integrated Care System has been working very closely with us and has been hugely supportive. And we've got a number of colleagues at a London level also who have been instrumental in helping us develop our plans for our new hospital. So a huge thank you to all our partners. That was the big achievement in the autumn, which was the strategic outline case. For the rest of the previous financial year, there's the outline business case, and we have been pressing on probably better than pretty much anybody else in England. And part of that has been working with a new team called the National New Hospital Programme, who have been established to sort of aid and assist us in even going faster in ensuring we get the new hospital built as quickly as possible. So key sort of headline there, SOC, the piece about the 1 to 500s, that's sort of like your big designs and your big drawings. We've been working closely with our clinicians on that 1 to 500 plan, and we're looking to embark on the next level of detail currently, which is sort of called the 1 to 200s. So as you come down a bit more detail from October onwards, and again, from all the exhibitions and webinars this year, we are hopefully taking on board everybody's feedback and sort of really updating our design to say that we've listened to our local population in developing a really state-of-the-art hospital that our local communities can be proud of. So I'll just pause there on the key highlights, and I'll pass over to Tahir with the wonders of technology. We'll just highlight the master plan. Are you there, Tahir?
I'm here, Jason. Thank you very much indeed. And good evening to everyone, and thank you for the opportunity this evening to present the master plan at a very high level at this stage. What you see are two images. The image on the left shows an overlay of the existing hospital, largely in grey, and then overlaid with what it will look like as part of the new hospital as we start to construct this. We are building a state-of-the-art hospital for its residents and beyond, and this will be the very best in healthcare services as well. The hospital is being constructed using modern methods of construction, and fully digitally enabled services within that hospital design as well. For the purposes of for today, I wanted to highlight that with the hospital, the new hospital will retain the same mix of services that we currently provide at Hillingdon, and it will be in a similar location or the same location as we currently have. Just to give you some orientation here, the junction to the north, which is shown as Peel Heath Road, if one can consider a road from that point heading southwards, all shown to the east here will be where the new hospital is. Sorry, to the west is where the new hospital is, and to the right of that, the existing hospital will continue to operate whilst we construct the new hospital in parallel with this. We also have already commenced that journey in terms of the works that we are doing. Some of you may have noticed we've constructed two very large, modern, high quality ward accommodation buildings, commonly known as Modular North and South. Those are in anticipation of the decanting of the services from the rather dilapidated annex buildings. That's the battery of sort of single story hospital wards that you see on the grey image, and relocating those into these new temporary locations whilst we de-risk the site ready for the new hospital. The new hospital itself will be much more easier to navigate. It will have all the correct functional suitability and clinical adjacencies. And we're also majoring on some of the key agendas of ensuring that this is a very nice environment, a healing environment, a home from home environment, a one that provides plenty of natural light at all levels and into all wards. So that in doing so, we've actually given consideration to placing some of the wards at the higher levels where you can enjoy great views across Hillingdon as well. We will absolutely enhance the facilities as they currently stand in Hillingdon, and this is a great opportunity to do so through the advancements of a modern, fit-for-purpose hospital. I'll pause there and hand back to Jason for the next slide.
Thank you, Tia. If we could just move on, there we go. So an unashamed plug. We'd love to hear from you all. So in terms of getting involved, there's our website. Please, if you get a chance, visit. Any feedback we're listening to at the moment, so please let us know your views. And then if we just go on to the next one. So in terms of next steps, so we're in the next financial year, and we're progressing with our outline business case. We're working very closely with our local authority colleagues on our planning application, and are making sort of very good progress in terms of all their feedback and incorporating everything that's required. And then hopefully, sort of as COVID restrictions ease, I know hopefully most of you have had a chance to join one of our webinars, but we also are very much looking forward to getting out and visiting our local communities and talking through our plans in person. So there's the key bits. But as ever, huge thank you to all our staff who have delivered fantastic progress, and thank you to all our partners for all their support.
Mute myself. Thank you very much. Well done, guys. Thank you very much, and thank you to all the presenters. And that brings us on to questions. And can I just, Justine, do you want to just say a little bit more about the rules of the game on questions?
Yes, happily. If people would like to put their hands up, so use the hand icon to put your hand up, and then the chairman can call you to speak. And your microphones have been enabled so that you can ask a question simply by unmuting yourself once the chairman calls you to speak. We do have a question in the chat box, actually.
Let's have that.
on COVID-19, this is from Graham. On COVID-19, what percentage of staff have not been fully vaccinated, and what percentage of staff are taking and reporting the weekly lateral flow test results?
Very good. Let me hand that to. And actually, what I'm going to do is to, since she's said quite a lot, Melanie, can you start talking to us about that, please? Melanie?
Yes, yes, thank you, Chairman. Actually, we're just about to start our next round of vaccinations. So you would have heard on the news regarding the third vaccination for healthcare staff. That started yesterday for us. So our percentages, I don't have to hand, but it's possible that my colleague can talk about that. But where we're centred now is looking at our requirements to be able to vaccinate our staff for our third tranche of vaccines. We'll also be taking forward influenza vaccine from next week as well. So staff forward will be able to undertake not just their COVID vaccine, but also their flu.
Okay.
Amy, both Sue and Tony have their hands up as well, and Sue might have her hand up because she might want to answer that question.
All right, fine. Sue, please.
So in terms of the actual original vaccination programme, doses 1 and 2, we hit 91%, and we are aiming to go higher than that with dose number 3. In terms of the lateral flow kit, staff can report that both through our online trust system, but also through the Department of Health system on their smartphones. What tends to happen if we have to do a specific outbreak management, then we will 100% report against lateral flow tests for the period of that outbreak. But it's a very positive position to be in, and we have a clear plan in terms of dose number 3.
Very good. Let me come on to Tony Ellis.
Thank you. Would someone like to tell us a little bit about what's going on in Mount Vernon, please?
Okay, yes. Patricia, shall I start with you?
Yes, you can do, but Tina is our lead for the decant, and that's particularly important in terms of Mount Vernon, so I don't know if she wants to take the question.
Happy to. I mean, in short answer, there's an awful lot going on at Mount Vernon currently. So we are very heavily reliant on Mount Vernon for our elective recovery programme. So as most of you will know, any low complexity surgery happens at Mount Vernon, and that has increased significantly post-COVID. So we've been hitting about 113% of the activity we were doing at Mount Vernon previously. We have also moved over quite a number of outpatient clinics during COVID, which will the clinicians are very happy over there. The patients seem very happy, so we'll be maintaining those services there for the time being, whilst we're quite constrained for outpatient space. In addition, quite a number of our corporate services will be decanting to Mount Vernon to make space for our clinical teams to stay on site, so that we keep clinicians near the patients as appropriate. We're also looking at decanting a couple of smaller clinical services, so paediatric audiology and our breast service, or some of our breast service, over to Mount Vernon. As that is our green pathway mostly site, apart from the urgent care nurse practitioner service, we will also be looking to see what else we can do on that site. For example, there are some old endoscopy rooms that aren't any longer used for endoscopy because that was moved to a different area at Mount Vernon, to see if we can use those for outpatient procedures on the green site. And in addition, we continue to explore what other clinical services are better placed on a green site, and therefore we could position them there, at least for the time being, whilst we know that COVID is going to be around for some time to come. We also continue to work with our partner organisations to make sure that we can maximise the use of diagnostics, for example, and we have put in an extra ultrasound room at Mount Vernon, as well as the mammography, so the breast imaging, moving over to Mount Vernon. So I think, in short, a lot is happening at Mount Vernon currently, and we're expecting the people activity, so the number of staff and patients, to increase, particularly over the decamp period.
Very good, thank you, thank you. Have we got any other questions?
I can see that another question has come into the chat box, so I'll read that out. This is from Robert. In light of the hospital redevelopment plans, what arrangements have been put in place to minimise the patient's carbon footprint while being treated? And we've got in Patricia's slides, there was some really good stats on our activities, on our environmental and sustainability activities. But
well, Patricia, you start with this question and then hand it where you like once you said what you want to say about it, please.
So in terms of where we are now, we have a very clear sustainability agenda, and are actively working as a trust to reduce our carbon footprint overall. I think like Jason or Tia have worked a very clear message in terms of the redevelopment for quite a lot of feedback.
Thank you, Patricia. I can pick this up. So the new hospital has been designed to meet the new net zero carbon ambitions for what is actually set for 2035. So our aspiration is to meet that at least a decade before it's actually mandatory to meet the net zero carbon requirements. It will be a fully sustainable, energy efficient hospital. That's not just in its construction and its embedded carbon, but actually we've taken it a stage further to ensure that it's embedded within the facilities management of the hospital as well. So by doing so, we are working with a number of partners, including the centre, to seek guidance where we can have clinical and non-clinical services ensuring that those co-adjacencies are aligned to have an efficient pathway for patients and avoid duplication throughout the building. And then that is further complemented by the way the hospital itself will function to avoid duplication, to avoid cross infection control issues, and therefore ensuring a much more streamlined and efficient way to run a hospital in line with those net zero carbon agendas as they are emerging at the NHS.
Very good, thanks very much. Now there are some other.
Amos, we have another question, if I may read it out for you.
Yes, of course.
And this is actually from Steve, who runs Radio Hillingdon, but his question is: are there any plans to reintroduce an evening and weekend meal service in the Choices restaurant? The microwave meals are very expensive and poor quality. If you're working a late or night shift, it's important to have hot meals, especially in the winter months. Steve, thank you very much for your question.
Should we hear you as the estates guy on that, or?
Amos, I'm happy to take that one.
Okay, you go ahead.
The answer is, at the moment, no, we're not planning to reintroduce the evening and weekend service. There wasn't enough uptake to justify the cost of having staff on site to serve hot meals. However, I mean, it's very helpful feedback from Steve, because I think there was a lot of research done on how we could have microwave meals available, and if they're not satisfying staff needs, and I see there's a thumbs up from someone else on the call, we'll certainly look into that. And Steve, I can come back to you separately about that. Can I also just take the opportunity, given that we've had a question from Steve, just acknowledge that this year is the 50th anniversary of Hillingdon Hospital Radio. A huge credit to Steve and his team of volunteers who run the hospital radio. And can I just recommend that if you haven't got their phone, you should get it on your phone, and it's a very good list. So thank you to Stephen for providing that service for staff and patients.
Seems to. Any other questions that I'm maybe missing? But looking at the chat box, I think that's about it.
I think that is it, and we didn't have any questions submitted in advance of the meeting.
Very good.
The only hand that I could see up momentarily was Sue, so I don't know but Sue has put her hand down now.
Seems like it's staying there. Just in conclusion then, and thank you very much for that. Thank you to all the presenters. I think you did a really great job and showed how passionately you feel about the trust and what you're doing in it. I just want to take a chance before we close to acknowledge the contribution of some people that haven't been mentioned so far. And the first I wanted to do is to mention two of our very long-serving non-executive directors who retired during the year. One of them, Richard Whittington, who did a fantastic job as chair of the audit committee for many years, and very, very highly valued professional advice during that time. And the other is Professor Liz Pace, who once again served as not only an interim chair and also as my deputy chair, and I think she did a fantastic job and cared enormously, particularly about patient care. And I know that she and Tony Ellis were close colleagues in that. So I wanted to mention them because they deserve all of the recognition we can possibly give them. And then finally, I also want to acknowledge with thanks the contribution that Leslie Watts has made as the board advisor during that period. I think a lot of the forward momentum you see clinically has been helped by having access to resources from outside Hillingdon who've come to work with us, and we really appreciate that. We're grateful for it. Our mission is to improve our services to our patients. That is the thing that matters most, and therefore anyone who can help us with that, we're very grateful to move forward. So with that, thank you very much, everyone. I'm going to declare the meeting closed. Thank you very much indeed.